Cavity is kind of diseases caused by the bacteria inside of the mouth. Yeah, there is a decaying process. Yeah, major disease in the mouth is classified as three categories. So one is cavity, the other is gum problem, and the last one is the malalignment. Anyway, the first two of the cavity and gum problem is caused by bacteria. So cavity is kind of bacteria causing decaying process. Most of cases, there are two kinds of cavity. One is just cavity developed in the crown. The other cavity is called root cavity. But most of root cavities is closely related to gum diseases. So normal and the stereotype of the crown cavity is caused by the bacteria is causing decay. Anyway, the symptom. Whenever there is a cavity developed, the first symptom is kind of cold sensitivities and sweet sensitivity. When you eat cold or cold water, or when you eat some sweet food, the patient can feel some sharp pain. That is the first symptom of decay. But as the disease develops more severe stages, cold sensitivities change to hot sensitivities, and once the hot sensitivity, the stage of hot sensitivity gets more severe, we can have some bite pain. Yeah, small cavities can be treated as a filling, but the more big cavities, we should think about making partial restoration, such as on-nay or in-nay. But big cavities should be covered by the crown. But sometimes, to prevent more complications, we should think about looking at it together. Anyway, as I said, the cavity is caused by the bacteria. And the bacteria is in the mouth. You can see the bacteria in the form of a plaque and calculus. So there is no plaque, there is no calculus, there is no cavity. So removing plaque and calculus is very important step to prevent cavity or gum diseases. So even as a patient doesn't have any cavity problem as long as there's no plaque. So control and removing plaque is the most important step to prevent cavity. So to prevent the cavity plaque, we should clean more carefully. So actually my recommendation for patients, one meticulous toothbrushing at one day. So I think even though they can skip some the breakfast and lunch toothbrushing, but people should clean very, very carefully at night before go to the bed. And that's my recommendation, such as use process and use incidental process and more correct motion. Toothbrushing is very important to prevent cavity. For normal patients, I think every 6 months is recommended to check out. But some have severe problems. Some patients have big problems, such as easily plaque is accumulated patient. I think it's better check up every 3 months.